joined us today in the 206th episode of this knowledge voyage. I, Dr. Jitika Tukal, on behalf of Rashtriya Ayurveda Vidyapeeth, welcome you all for today's session. On the onset, we would also like to express our heartfelt gratitude and welcome our mentors who have always been there to guide, motivate, and encourage us for sustenance of this series. Respected Vedeshri Devendra Triguna Sir, President Governing Body Member RAV, respected Vedeshri Rajesh Kutecha Sir, Secretary Ministry of Ayush, respected Dr. Vandana Siroha Ma'am, Director Rashtriya Ayurveda Vidyapeeth. Now let us begin the session by seeking the blessings of Lord Dhanva. Namami Dhanvantiriyaadidevam Surasudaivandityapad Loke Jharaluk Bhayamrityunasham Dhataramisham Vividoshadhina Om Dhanvantaraya. Moving forward, I would like to introduce our eminent speaker today, that is Dr. N. Devan Namboothiri sir. Before that, I would like to tell the topic about the sir will be discussing, that is some insights into the topic of Shatkriya-kalam, a clinical perspective. For that, I will be afterwards we shall begin the lecture. Dr. N. Devan Namboothiri sir had studied at Ayurveda College, Coimbatore. Afterwards, sir has started private practice and also acquired knowledge in various subjects like Vyakaran, Nyaya, Mimamsa, Advaita Vedanta, Yoga, Ayurveda, Hasti Ayurveda, etc. under Gurukula system with eminent scholars there. Here is the founder, and sir is the founder and chief physician of Ashokalayam Ayurveda Chikitsa Kendram, Tiruvegapura, and chief consulting physician of Pumali Mana Ayurveda Center, Peringode. He is also a consulting physician of Nandavam Hospital, Ottapalli. Now, Dr. N. Devan Namboothiri sir is providing his services to Purnatara Gaj Samrakshan Kendra of Guruvayur Devaswam as a Jiva Dhanam expert committee member. Sir is principal of Hasti Ayurveda Pathan Gavikshan Kendram, Guruvayur. Now, I would request Dr. N. Devan Namboothiri sir to kindly proceed with the lecture.
Shall I start?
Shall, please, sir, please.
Sadashivasamarambham Shankaracharya Madhyamam Asmadacharya Varyandam Vande Guru Parambaram. Nagadirogan Satadanushakran Asheshakaya Prasradan Asheshan Avulsukyamoha Aratidan Jaghana Yogurva Vaidyaya Namostu Tasmai. Shankham Chakramaparyadhashchakarayor Divyaushadham Vikshine Vamenanyakarena Sambhrita Sudha Kumbham Jalukamapi Viprana Karunamaya Sukhagara Sarvamaya Dhavamsaka Kshipranno Duridam Chinattu Bhagavan Dhanvantari Paduna. Namaskaram to all eminent personalities. Actually, I am for the first time in this screen. So whatever we study in the text, either Shatkriya-kalam, Panchalakshana Nidanam, or whatever may be the textual points, they are or they can be effectively utilized in the practical field also. My Guru, Vaidyamadham Varyanarayana Namboothiri and Pumali Neelakantham Namboothiripad, etc. They followed such a path. So when I was asked, I told that either Panchalakshana Nidanam, the application of Panchalakshana Nidanam in Chikitsa, or Shatkriya-kalam in Chikitsa, or Sama Nirama Avastha in Chikitsa, whatever may be the subject, I shall try to tell the application of the subject in the practical field. So then, from the office, they told that please share the subject of Shatkriya-kalam. We everybody know that. Sanjayanja Pragovanja Prasaram Sthana Samshrayam Vyakrim Bhedamja Yo Veti Yoganam Sabhave. So here I am trying to explain the first one, these Shatkriya-kalams, basing on Sushruta Samhita. We know Edani Khali Dosha Sthanani Eshu Sanjiyante Doshaha Pra Sanjaya Hetu Duktaha Dosha Sthanani Hrna Bhyoradho Madhyortha Samsrayaha Vada Pitta Kapha Eshu Sanjiyante Doshaha Eshu Sthaneshu Doshaha Sanjiyante Pra Sanjaya Hetu. And we know Chaya Vruddhi Sudhamuni Eva. Padasthane Vruddhi, Padasya Chaya. Pittasthane Vruddhi, Pitta Chaya. Kapasthane Vruddhi, Kapha Chaya. Pra Sanjaya Hetu. Tatra Sanjidanam Khalu Doshanam Tabdha Purna Kosthata in Vadam. Pidava Bhasata in Pitta. Mandoshmadacha Angana in Kapham. Gauravam Alasyam Chayakarana Vidveshascha iti Lingani. So in Vada Sanjaya Lakshana, Stabdha Purna Kosthata, and Stabdha Purna Kosthata is the Vada Sanjaya Lakshana. So we already know that some bloated feeling or heaviness of the stomach and heaviness in the stomach and the adho vayu is not passed properly and some sort of total heaviness of the body also. And Pitta Sanjaya Lakshana, Pidava Bhasata and Mandoshmata, slight yellowing of the body or the temperature of the body will be reduced or by touch the temperature may be felt reduced. In Kapha Sanjaya, Anganam Gauravam, heaviness of the Angas. Nikdas Shidom Gurur Mandaha Salakshno Mrilstha Thira Kapha. So because of the heaviness of the Kapha dosha, we know the Angana Gauravam. So when we come to the therapeutic measure, Nidana Parivartana is very important. All the rogas are having Sanjaya Avastha, Prakopa Avastha of doshas, Prasara Avastha of doshas. So here I am trying to take the Vadarakta as an example. So then it will be more easy, I think. So in Vadarakta, the beginning stage of Vadarakta, slight reddish skin eruptions and slight reddish patches here and there in the extremities, especially below the knees and here on the hand, etc. So in such a condition, sometimes a slight temperature increase of the temperature at night also may be there because of the Rakada Anubandha, Aushnyam is there for me. So here, sometimes we may be able to see some sort of rise of temperature at night also sometimes. So in such conditions, when we see this in the patients, in such conditions, I used to give the practical aspect I am telling. I used to give Amrutottara Kwatham, Nagara Amrita Haritaki Kramal, Nagahasta Ayanankri Bhadasha. Amrita 6 parts, Haritaki 4 parts, we know, and Shunti 3 parts. So when that is given, within 2-3 days, the temperature, rise of temperature at night will be reduced, and the slight reddish patches will be reduced. And within 1 week, if you are giving for continuously for 1 week, every lakshanas will be reduced. Chaya eva jayel doshan. So if you are doing in such a way, if you are doing or applying this, understanding this condition, chayo vruddhi swadhamani eva. In the chaya condition itself, we can give a good cure from the sufferings. And here, as we are giving this, if you are thinking about the yoga, Charakacharya tells that Amrita as an Agri Ausada, or Kevala Amrita Kritam, Kevala Amrita Tailam. Amrita have got, Guruji have got a very important role in the Vadarata Chikitsidam, and Haritaki, Dashamada Haritaki we know, and it have got the Ushnavirya and purgative property, and Shunti Aditikaram. It's a very simple yoga. So when this is applied, the patient will get very good relief within 1 week. The eruptions on the skin, reddish color, etc., and slight temperature rise in the night will be reduced. Here, this first step of the Sanchayam stage, as I applied the medicine, I got the result. I got a positive result in the patient. So in such a way, this Sanchaya, this principle is applied in the practical field. So again, next, Prakopa. Tesham Prakopal, Koshtadoda, Sanjarana, Amlika, Pipasa, Paridaha, Annadvesha, Hridayolkledascha, Jayante. Tatra, Dvitiya Kriya. Tesham Doshanam Prakopal. Pada Prakope Sati. Padasya Prakarishena Kopaha. Prakarishena Kupyate Vata. Iti chain. If the Vata is vitiated more and Prakopa occurs. What is, we know, Kopastu Unmarga Gamita. Udurdham Margam. Urdhva Marge Gamita. Gantum Icha. Gantum Vancha. That is Kopastu Unmarga Gamita. So in Vadakopa, Vadaprakopa Lakshanas, Koshtatodaha, Sancharana, abdominal pain and mobility, if some sort of thing is moving inside the stomach, we feel. Kuduguda Sabdam, etc., can be heard sometimes, and some sort of discomfort. Slight pain, dull pain also can be observed when the Vata is vitiated. And when the Pitta is in the Prakopa Avastha, Amlika, Pipasa, Paridaha, etc. In the Pitta Kopa, Amlika, sovereignty in the mouth. Pipasa, excessive thirst. And Paridaha, burning sensation. Here, one simple equation like sentence is there in Ashtanga Hridayam. Shulam na rate anilal. Shulam narte anilal. Daha pittal. Chopha kapodayal. So here, Amlika is there, Vipasa is there, Paridaha, Daha pittal. So that shows the Kopa, Prakopa, or of Pitta. So this we can, as a simple way, we can see in the patient that Pitta has been vitiated. So this Pitta vitiation can be recognized if we have got the Prakopa Lakshanas within our mind. We can understand, even though Vikaranama Akusalaha, na Jihriyal Kadajana, na hi sarva Vikaranam Nama Dosti Dhruva Acharya tells. So when we are seeing this Amliga and Vipasa, etc., the doctor can, the Vaidya can understand that yes, Pitta is with you. So for a treatment based on Tridosha principle, this Shatkriya-kalam, knowledge of Shatkriya-kalam is very helpful, and it will be very systematic also. And in the diagnosis, even though we are not recognizing in the first stage, we may not be able to recognize what is going to happen. So in such conditions, if we are if we have got a very sound knowledge in this Prakopa, Lakshanas of Vada, Pitta and Kapha, thinking about the Upashayam. So to see the Upashayam, we can give the medicine. So to treat basing on these Panchalakshana Nidanam, but basing on the Upashaya and Anupashaya, we can give the medicine even though we are not able to recognize or recognize the differential diagnosis. So in such a way, this Prakopa, the second of the Shatkriya-kalam, can be utilized. So for the accuracy of the differential diagnosis, this knowledge will be more helpful. Pitta Prakopa Lakshanas and Kapha Prakopa Lakshanas. Kapha Hridayolkleda Annadvesha Hridayolkledas. Annadvesha, hate of food, excessive mouth slobber. So coating of the tongue and dullness of the tongue and also dullness of the body, and he may feel some sort of heaviness of the body, etc. So when we are going to the Vadarakta as an example, as I told you, I told in the beginning, the Vadarakta, itching, mild dull pain, mild burning sensation, etc. may be there. So itching is due to the vitiation of kapha. Dull pain is due to Sulam Narate Anila, as it told by Vagbhadacharya. Mild burning sensation, Daha Pitta. So in the Prakopa Avastha, I gave the same this Amritottara Kwatham was. Of course, I couldn't recognize whether it is going to be a Vadarakta or something else. But by seeing the Lakshanas, I added one Virejana Dravya like Avipatikaram Churnam or Trivur Churnam, Sukha Virejana Churnam along with the same Amritottara Kwatham. So he got a very good purgation, and slowly the Lakshanas subsided. So with having this knowledge only, I could give the Amritottara Kwatham along Avivattikara Churna or Sukha Virejana Churnam out of the proper Virejanam. The dosha nirharanam was happened within 1 week, and the patient got relief. So in several cases, this happens. And Samjayancha, Prakopancha, then comes Prasada. Prakarashena Sarati. Iti Prasada. Sarati Vyapnoti, spreading. Evam Prakupitanam Prasaratam Vayoho Vimargagamana Adopo Osha Chosha Paridaha Dhumayanani Tasya Arochaka Avipaka Angasada Chardischa Iti Shleshmanaha Lingani Bhavanti Tatra Tridiya Kriyakalaha. Evam Prakarishena Kupitanam Doshanam Prasarata Prakarishena Sarati Charana means spreading, we already know it. Pragarishena saratam, those doshas which have reached a stage of prakopavastha, the next stage is prasara. For example, vayo vimargagamana atopau. What is the lakshana of vada prasarana lakshana? Vayo vimargagamana atopau. Vayo laghava laghutval. Basically, also the vayu have got a tendency to go up, especially in the case of apana vayu. If you are treating the diseases basing on the vada anulomya, the accuracy of the treatment will be more. So when that is applied, that approach is applied, the result will be very easy also. Osha, chosha, vayoho vimargagamana atopau. Vigata margagamanam, moving upwards, especially apana vayu, and guduguda shabda, adopo nama, guduguda shabda inside the stomach. So this is very common in gulma. In gulmo, we know gulmo bhaddasakrit vataha. That is gulma. So bhaddasakritvam is there. Out of this bhaddasakritvam, vata pradilomyam very easily occurs. And because of that, bhaddasakrit baddhavada, that is seen in gulma. So when we are giving medicine with vada property and virechana property, the patient will get cured. So, like that, in the prakopa avastha of, prasara avastha of pitta, osha, chosha, paridaha, dhumayanani pittasya. Oshaha, some sort of burning like feeling, some sort of vidaha like feeling inside the koshtha, and paridaha, specifically burning, dhumayanam, some sort of dhuma, smoky movement or smoky feeling inside the stomach, or smoky feeling all over the here and there in the body, etc., are the prasara lakshanas of pitta. Here we can think pittam sasneha tikshna ushnam laghu visram saram dravam. So saratva is a property of pitta. If the vada is vitiated and saratva property of pitta, pitta and rakta have got similar quality, similar property. And because of the saratvam of raktam and the vitiated chalatvam of vitiated vada or prasara of the vitiated vada together causes burning sensation here and there in the body. First, it will begin in the extremities, especially foot and hand and palm sometimes. Patients will tell. So from that, I used to assess that, yes, it has got a tendency towards father. So it is very easy to explain what is prasara in a disease. That's why I selected father. Pardon? Can you speak in English? I'm not too much fluent in Hindi.
गर्म हो जाते हैं पूरे ऊपर से हवा नहीं जाती डाल देंगे बढ़िया हो जाएगा डाल ले तू देखा अभी अब हम हटा रहा हट नहीं रहा है तो ये पहनने वाले कपड़े इसमें रखे हैं हमारे में धुले हुए
Kindly mute yourself.
पहनने पैंट वहां टंगा था क्या हैंगर में
We are unable to understand, sir. Who is speaking?
वो तो बहुत मिठा है भाई
Mohit Kumar, sir, please mute yourself.
और इन सर लोग ठाक तो नहीं दिया किसी को
He is muted, sir. You can continue.
Um, Dr. Nambudri sir, kindly continue.
Okay, thank you.
Sorry for interruption.
I know it's okay, it's okay. It's okay. Is it audible?
Yes, sir, audible, sir. Audible.
Okay.
Yes.
Thank
Kindly
you.
share the screen, sir. Yeah. Tell us.
Okay. Kosha, Chosha, Paridaha,
Yes.
Dhumayanani. So in the vitiation of Pitta or Prasara of Pitta, these lakshanas we are seeing, and especially as I told you, presented before, in the Gulma, if the Pitta Anubandha is there, some sort of burning sensation inside the stomach, especially at the area of duodenum, and gas problem will be the out of the in colloquially we are telling gas problem will be the adhvanam will be the and guduguda shabdam aropam will be the and burning sensation at the place of duodenum will be there. Most cases of parinama shula are mainly due to the prakopa prasara avastha of pitta. So this we can diagnose in prior. So when we are seeing these lakshanas, considering the vitiation of pitta, pitte dadyad direti, we can administer direti. So arochaka, abhipaka, angasada, chardischa iti shleshmanolingani bhavanti. So what is the, even though snigdha shiro gurur mandaha shlakshno mralsa sthira kapha, the nature of kapha is like that. Here in the prasara avastha of kapha dushti, arochaka, dullness of the person will not be able to understand the taste. Abhipak, the food taken has not digested properly. Angasada, some sort of tiredness or the lazy feeling or the little mobility of the angas. Chardihi. Amashya ulklesha bhavaha prayas chardya. The chardi nidanam is specifically meant. Cha iti shleshmanaha. Here we can add prasara nidani. So in the Gulma, this is very helpful to understand. In Vadarakta, when we are going through Vadarakta, I am mainly taking that one. Vadarakta, this status is very important. In both Rakta and Vada are fast spreading in nature, Tara in nature, and because of the mobility of Vada, the Sara Rakta is fused, and that will cause some sort of burning sensation here and there in the body and extremities, etc. And if there is a combination of vitiated kapha also, both pain and eruptions can be seen here and there, mild feverish feeling, especially at night, and also dullness of the body if the kapha is also joined with in this Vadarakta condition. So in such a state, I used to give either Gandharva Hastadi Kvata at morning Otherwise, Sushrutacharya's Chitraka Indrayave Patha Katukati Vishabhaya, that Sushrutacharya's Shadharana Yoga, Kwatha will be given. Here we have to think about the Ama. Srotorodha, Balabhramsa, Gaurava, Anilamudhada, Alasya, Apakri, Nishtiva, Malasanga, Aruchi, Klamaha, Lingam, Malanam, Samanam. If we are thinking, joining these two things, so we can recognize the Amavastha, especially in the Vada. Not only in Vadaraktam, every disease. So every disease have got, we know for every disease, Amavastha is there. So the basic definition of Amavastha, especially in Ashtanga Hridaya, our GURURAJA tells us, Srotorodha, the blockage of throats. That blockage is mainly due to the blockage caused by the vitiated kapha and out of that, because of the blockage, balabhramsha will be there. So the balabhramsam, that loss of the strength, we can call it. Balam, and here also, balam hi, agni balam pumsam, vayu balam pumsam, both we have to consider. So in prasara avastha also, not to lead an acute condition, we can give the medicine for the niramikaran. Gaurava, snigdha shido gurul mandaha slakshno mrilsaha, snigdha shitaha guruhu and mandaha. To get rid of these lakshanas, if you are applying this Sushrutacharya's Shadharana, that which is told in the Amavada Chikitsikam, as I told you, Chitraga, Indrayave Patha, Kaduka Adivisha Abhayati, that is given. First of all, the patient will tell that some sort of rubbing pain or scratching pain inside the stomach is there, and some sort of mobility of in the inside the stomach, and dull another pain in the stomach, etc. And he will have frequent 5-6 times of bowel movement, along with little kapha, and watery, sometimes watery with sometimes watery, and sometimes along with sticky kapha. So within 3-4 days, this dullness and arochaka, avipaka, angasada, chaddi, etc. will be reduced. And the patient will tell that, sir, my body is very light, I feel very comfortable. Actually, there is no much pain. So the Nirama Avastha we can observe. So we are seeing in the patient, getting rid of Srodorodha and getting rid of Balabhramsa, getting rid of Gaurava and Anilamudha, dullness of the mobility, dull mobility of the air inside the stomach. Alasya will be reduced. Apakri will be reduced. Nishtiva also will be reduced. Malasanga will be reduced. Aruchi also will be reduced. Klama, those things will be reduced. So slowly he will lead to a state of Nirama Avastha, total lightness of the body. Yes, this we can see in the patient, especially in the Vadarakta patients, in Amavada patient, Nirama Avastha we can observe. So the prasara condition is properly managed in such a state. In several patients, I am seeing, I have kept so many records also. And here, the knowledge of Shatkriya-kalam only helped me to give an appropriate, to get an appropriate diagnosis and to give an appropriate medicine. And here, in Kerala, we use Gandharva Hastadi Kwatham also. We can think about the property of that and the combination. Gandharva Hasta, चिरिबिल्व उताश विश्व पथ्या पुनर्नव यवाशक भूमितालैः बाधः स सैन्धवगुणं पवनस्य शान्त्यै वायोः शान्त्यै वह्नेर्बलाय अग्निबलाय पित्तस्य बलाय रुचये to improve the taste malashodhanaya. So this is also another good combination to reduce the prasara avastha of the yoga. As I told you in the beginning, even though we are not vikaranama akushalaha, if we are very thorough with the three dosha principle and Shatkriya-kalam, out of that only I gave, even though I was doubtful, Budalingam Vyadhim Upasayabhyam Parikshayata, basing on that principle, I gave. And this Nirama Avastha was attained. And we can see Kevalam Nirupastambham Adus Nehirupachare in Vadaroga Chikitzam in the beginning. So Upastabdhavastha is managed. Out of the knowledge of this prasara only, I could give this. So whenever we get a result, we have to think how the medicine has acted. What is the principle behind that? When that is taught in the academical institutions properly, eminent knowledge of Vaidyas will be developed, I am sure. At present, I am not speaking for the eminent doctors. I am presenting this for the students, those who want to develop the knowledge and develop the principles and develop how the principles are influencing in the systematic way of treatment. So what the acharyas have written in the book, they are 100% practical. It should be brought to the practical field. For that, deep knowledge in Sanskrit is inevitable, and deep knowledge in the Panchabhuta Siddhanta is inevitable. For that, we have to study Nyaya Shastram in basic form, and also Sankhya Shastram should be studied on which our Panchabhuta Siddhanta is developed. And then comes the Prasara and Sthana Samshaya. Sthana Samshaya. Sthane Samashriyate. Upita doshas, prasrita doshas. Goes to a Sthana Samshaya. Sthana Samshrayam. Ata urdhvam. Sthanasya Samshrayam Ashrayam Pakshayavaha. Evam praguvidaha tamtan sharira pradeshan agamya tamstan vyadhin janayanti. Te yada udarasannivesham kurvanti tada gulma vidradhi
So screen is not visible. There is some network issue. I have connected with our expert. Sir will be sharing the screen soon.
Namaskaram, is it audible?
Yes, audible, sir. Audible.
So we are under Sthana Samsrayam.
Yes, sir. The screen is not visible, sir. I have to share the screen again, sir.
It's
Screen share option is not visible, madam.
Sir, you can share the screen. You have previously connected via other device also, na?
Unable to.
Otherwise, you can share, sir. It is on the left of the leave button. It is written share there, na? You can go by here. Shall I share the screen, sir?
Yes, please, please.
Okay, I'll.
CEO right now, AD cancel, DT cancel, admin officer cancel, system director cancel, PS cancel, technical officer रहेंगे 4 और office assistant रहेंगे 2 और उसके बाद ये रहेंगे consultant admin, consultant account, UDC LDC भी cancel, MTA change करो.
अच्छा कभी लाएगा फिर कुछ करता
Is it visible, sir?
Yes.
Yes. One
Okay,
second.
sir.
One second.
Yeah. I should go this slide, na?
Yes.
Yes.
Okay, sir.
Next, next.
You continue with the lecture, sir. I'll do. Just guide me with the slides. Yes, sir.
Next slide.
Next slide.
Okay, sir.
Fourth one.
Okay, sir.
Yes.
Okay, okay, sir.
Okay.
You continue with the lecture, sir, please. Yes.
Yes. वस्तिगताः प्रमेयः अस्मरी मूत्राघात मूत्रदोष प्रभृतीन् मेढ्रगताः निरुद्धप्रकश उपदंश शूकदोष प्रभृतीन् गुदगताः भगन्धर अरिष प्रभृतीन् कृष्णगताः वृद्धीः ऊर्ध्वजतृगताः ऊर्ध्वजतृगान् त्वं मांस शोणित क्षुद्ररोगान् कुष्ठानि विसर्पांश्च. So you can go through the text and hear the brief of the text. Thane samshriya. So the vitiated doshas, where were they located? That is called as sthana samshriya. Accordingly, the diseases will be done. So as in Vadarakta, Vadarakta doshas gets localized in joints. Thus the symptoms in the joints, and we see the swelling on the joints, some sort of reddishness in the joints, and some sort of heavy pain in the joints, especially in the ankle joints and knee joints, etc. So when the heaviness is there, and daha, osha, plosha, etc. in the knee joints, or in the ankle joints, or in the fingers, just like gout also we can see. So we can think this as a stage of sthana samshrayam. So the sthana, knee is a sthana, and finger joints is another sthana, or even in the manibandha also we can see this another sthana, sthane samshriya. So when the swelling is there, sopak kapodaya. When the reddishness is there, pittal, daha, pittal, and there the reddish color and osha, plosha, dhumayana, etc. also may be there. That shows that the vitiation of pitta and because of the blockage of vayu, especially vyano hridisthitaha krisadehachari mahajavaha gatya avakshepana ulkshepa nimesha unmeshanadiga praya sarvaha kriya. So for according to the depth of the vitiated doshas, the vitiation of Vyanavayu also sometimes we may be able to see. So there also, first of all, we may have to give the Amapasana. So to here also we can think that yes, I am giving the medicine in the stage of this clear about the disease and Kudalingam Vyadhim Upashayanupashayabhyam Parikshayada, and thinking that so Niramikarana process we can give the same Chitrakati Kwat. So it may take 2 weeks to attain the Nirama Avastha and to wipe out the vitiated doshas, blocked Vayu and blocked Pitta, and the cost for the blockage, which is Kapha, also will be eliminated by giving this Chitrakati or Gandharva Hastadi Kwat. So to reach that diagnosis, primary diagnosis, this Shatkriya-kala have helped me. So then comes Vyakti. अत ऊर्ध्वं व्याधेः दर्शनं वक्ष्यामः। व्याधेः दर्शनं व्याधेः व्यक्तिभावः. Especially as I told you, we also know that in Vadaraktam, joint swelling, every joint will be swelling. Sometimes heaviness of the neck also will be there, heaviness of the shoulder will be there, heaviness of the ankle joints will be there, heaviness of the knee joints will be there, and the patient may not be able to move, and some sort of total heaviness and swelling on every extremities also may be. So this is an advanced stage. And there also, if we are getting such a patient, there also we may have to give, first of all, Amapachana or Amapachana, medicine for Amapachanam and Doshanam. In such a condition also, the patient comes in front of a Vaidya. Even the same Chitrakadi Kwatham, either Chitrakadi Kwatham or Gandharvahastadi Kwatham. If you are giving the Amrutattara Kwatham, Nagara Amrata Haritaki Kramal, Nagahasta, Nayanagri Bhagasha. If you are giving, the prognosis will be slow. The apt medicine that we have to give is Chitrakadi Kwatham, Chadharana, Yoga of Susaracharya. If that is given, just as I told in the beginning, before, the vitiated kapha will be, Ulkrishta kapha will be brought to the stomach, and it will be passed along with the stool, and some sort of scraping feeling will be there in the stomach, and slowly within 1 or 2 weeks, most probably in the Vyakti Bhava stage, it will take at least 2 weeks to clear the system. Then the swelling, etc., will be reduced, and only the pain, some sort of burning sensation. In such stages, we will be able to give the Vyadhi Viparita. So in Kerala, we used to give Dasna Avastha, and also in Avastha.
Sir, shall I change the slide?
Pardon?
Shall I change the slide, sir? Next slide.
Yes. And Vyaktim Bheda, Vyakti Bhava. Ada Urdhvam Vyadhe Darshanam Vakshyamaha Shobha Arbuda Grandhi Vidradhi Visarpa Prabhadinam Pravyakta Lakshanada Jvara Adisara Prabhadinam Cha Atra Panchama Kriyakala. So next comes Bheda. Ada Urdhvam Edesham Avadirnanam Pranabhavamavannanam Shashtha Kriyakala Bheda. Jvara Adisara Prabhadinam Cha Dirghakala Anubandha. Tatra Pratikriyamane Asadhyadam Upaya. So in such a stage, if the patient reaches, we may not, the disease may reach to a stage of asadhya. So to get clear-cut observation for the sadhya asadhyata also, this Shatkriya knowledge of Shatkriya-kalam knowledge is very, very important, and it is very helpful also. So in the Vyakti Bhava, it is a little more tough. So in the Vyakti Bhava also, if a patient comes, so the lakshanas will be, and so many lakshanas will be there, and the patient will not be able to suffer the aches and pains, sufferings of the disease. And in such a stage also, we may have to give the aushadha or medicine for niramikarana. Otherwise, the treatment will not be successful, especially in Vadara. So after the knowledge of the Shatkriya-kalam, only I could give this Chitrakadi Kwatham in the beginning, and after 2 weeks, slowly Niramikarnam came, and then only I told them to apply oil. My guru also was like, in such heavy and dull pain, burning sensation, etc. in the body and totally swelled body, only Chitrakadi Kwatham will be given. No other oil application. So thinking this Shatkriya-kalam only he had gone. At present, I feel that he was thinking in such a way, especially Vaidyamutham Varyanarayanam. In such stages, he never gives oil. First of all, he used to give this Chitrakadi Kwatham for 2 weeks. In such stages, he will give the Chitrakadi Kwatham only in morning, no other medicines. At evening, Vedanayascha Krantanam, some local applications, etc., will be something like Grihadhuma Vaja Kushtha, etc. Powder will be there, just to reduce the swelling. And after 2 weeks, when the patient comes, he will tell them, sir, I have got very good relief. There is no much pain. So in such stage comes, the next stage, he used to give Gandharvahastati Kwatham morning and evening. Sometimes Rasna Guruchi Merendam Devadaru Mahaushadham, Rasna Panchaka Kwatham. That's the traditional approach of treatment in Kerala, especially of Vaidyamutham Varyanarayanam. And after giving this for 2 more weeks, then he will start morning again Gandharvahastadi Kwatham. If some Samavastha is for Ama Anubandha is there, to rule out that, he will again continue the Gandharvahastadi Kwatham. And evening Vyadhi Varidam, Yasna Yendavala, Sahadara Varirus Parishavashamrata, or Kogilakshamrata Kwatham, Vadarakta Nibarihana. Or like Valiya Rasa, that is Rasna Tamalaki, that yoga will be given according to the bodily conditions. So this Shatkriya-kalam and Nidana Pancham and Samavastha, Niramavastha, Trivida Pariksha, Ashtasthana Pariksha, Dashavidha Pariksha, everything can be utilized in the diagnosis of and treatment. It should be utilized, then only it will be an Ayurvedic approach. So purposefully only I told to start with Shatkriya-kalam. Okay, I think that it is somewhat clear. And if any questions are there from those who are hearing the speech, you can ask me. I shall try to clear the doubts. So in the Bheda Avastha, if the disease is reached, we can keep the disease in a yapya. So give medicine and try to give relief, get the relief for the patient, like that the span of the life with a better life, better living we can provide. This is our Ayurvedic approach. If any questions are there, I shall try to answer for that.
Are we done with the lecture, sir? Are we done with the lecture, sir?
Yes, at present I have just.
Okay, sir. I shall continue with the doubt session. If anybody have doubt, then they will ask. Okay.
Okay. Yes.
Okay. I request all the students, all the dear students, if anybody want to discuss something or have any doubts regarding the today's topic, then please you can ask your queries.
Namaskaram.
इस बारे में कोई वेटिंग लिस्ट कुछ नहीं रखा ये भी अगर 2 दिन में भाग गया तो
नमस्कार सर
ये ना 3 लोग तो वेटिंग लिस्ट लिखते हैं ना पूछो ना पीछा कर से कैसे लिखते हैं बना के मैं तो डाल दूं बोले मैं ये लिखूं वेटिंग लिस्ट लिखना होता है अगर ये नहीं आया तो
वेबसाइट में पब्लिश करते वक्त करना है, नहीं करना, पूछो. Any queries from the students? I have checked the chat box. There is no query also. Okay, now, so we should proceed with the vote of.
Any questions for the students or doctors?
Okay. On behalf of organizing committee, I would really like to thank Dr. Anand Devan Nambudiri sir for delivering such insightful lecture. I would like to extend my sincere gratitude to our mentor, Vedant Devendra Trigunaji, President, Governing Body Member RAB, for his continuous support, guidance and blessings. We thank our Director Ma'am, Dr. Vandana Sirova, who is the guiding force for all the events at RAB. I would also like to thank our Secretary Minister of Fire, Shweta Rajesh Kutecha sir, for his participation and encouragement in all these endeavors. At the end, I would like to thank all the students, and I also encourage them in the previous lecture also, I also encourage them to you should be more acquainted regarding the lecture, regarding the topic we share already in the flyer. You should do some uh, previous work so that you can be more with the queries. As we have a great opportunity that we have our eminent speakers on the board, that they are so much keen to learn, make us learn, to teach us the new fundamentals in a different way. So I request all the students kindly be more productive during the session and could prepare with their queries so you can have more worth of this session. Thank you so much, sir. The next webinar will be the next Thursday. The flyer will be arranged soon. Thank you so much.
Thank you for all.
Thank you so much,
Thank you for
Nambudiri sir.
getting.
Thank you so much, Sri Kumar sir. Thank you so much. I can see all our gurus also. I will really appreciate if other topics will be shared. Then we can be scheduling the upcoming sessions of the Gyan Ganga. Thank you so much.
Okay.
Okay. Thank you so much, sir.
പക്ഷെ ഇപ്പൊ ഇവിടെ 5 ദിവസം 5 ദിവസമായി വർക്ക് നിർത്തിയിട്ട് വരാൻ ഇവിടുത്തെ ഭയങ്കര പെയിൻ ഭയങ്കര വേദന അവിടുന്ന് ഇങ്ങനെ അവിടെ വരെ ഉണ്ട് നീർക്കെട്ടുണ്ട് ഭയങ്കര നീർക്കെട്ടുണ്ട്
ബാക്കിലോട്ട് വരില്ല
ബാക്കിലേക്ക് വരില്ല ഭയങ്കര പാടാണ്
അത്രേ വരുള്ളൂ
ഇങ്ങനെ കൊണ്ടിരിക്കാം ഇങ്ങനെ കെട്ടുമ്പോ
താമസിക്കുന്നുണ്ടല്ലേ വെള്ളിക്കുളങ്ങര
ഇങ്ങനെ തന്നെ പിടിച്ചു കിടക്കാം എന്നാലും താഴെ പിന്നെ പിന്നെ ഉറക്കം തീരെ കിട്ടുന്നില്ല രക്ഷയില്ല ഭയങ്കര പെയിൻ കാരണമാണ്
കഴിഞ്ഞ വർഷം കിഴി കേട്ടല്ലേ എന്നവിടെ നിന്നാണ് ചെയ്തത് അവിടെ നിന്ന് ചെയ്തതാണോ പോയി വരാൻ ഒരു കിഴി വേണമെങ്കിൽ ഇടാൻ വരുന്ന 7 ദിവസത്തേക്ക് വന്ന് ചെയ്താൽ മതി ഇപ്പൊ എന്ത് പണി ചെയ്യുന്നു
ഇപ്പൊ പണിയൊന്നുമില്ല
ഒന്നുമില്ല
പണി നിർത്തിയിട്ട്
വരുന്നതല്ല പേരെന്നോ
കാഴ്ചയുടെ പോലെയുണ്ട് ഒപ്പം തീരെ കിട്ടല്ല ഇത് ഭയങ്കര തളർച്ച ഒപ്പില്ലാത്ത തളർച്ച
എന്ത് പണി ചെയ്തോണ്ടിരുന്നത് ടാപ്പിംഗ് ആണ് ഷുഗർ ഇല്ലല്ലേ
ഷുഗർ 170 ഒരു വർഷത്തിന് ശേഷം ഷുഗർ ഓൾറെഡി ഉണ്ട് അതിന്റെ ഗുളിക കഴിച്ചിട്ടുണ്ട് കാറ്റലിംഗ് എന്ന് പറഞ്ഞിട്ട് സമയത്ത്
ഷുഗറിന്റെ
മാസത്തെ ഗുളിക ഇടയ്ക്ക് കൂടും ഇടയ്ക്ക് ദൈവം
ഇതൊന്ന് കഴിക്കട്ടെ നാളെ ഒരു എത്ര മണിക്ക് വരാൻ പറ്റും 9:30 10 മണിയോടെ ഇവിടെ എത്തിക്കോട്ടെ ഈ തുണ്ട് കൊണ്ടുവരണേ
നാളെ നടക്കൂല്ലോ
നാളെ തന്നെ തുടങ്ങും ഒരു തോർത്തും ഷോപ്പും കൂടെ വെച്ചിട്ടുണ്ട് നാളെ തന്നെ തുടങ്ങും നീട്ടണ്ട ഇനിയിപ്പോ ശനി ഞായറും ഒക്കെ ഈ തുണ്ട് കൊണ്ടുവരണേ മരുന്ന് ഞാൻ തരാം ഇപ്പൊ എല്ലാം ഓരോ ഗുളികയും 2 പേര് ശേഷം മതി. ബാക്കി അവിടെ വന്നിട്ട് ഒക്കെ ചെയ്യാം.
अच्छा 2 आदमी बचे कैसे?
वही तो
അഞ്ഞൂറ്. നാളെ വന്നോ? ഞാനുണ്ടാവും. ഞാൻ 10 മണിക്ക്. 10 മണിക്കുണ്ടാവും.